Okay.
Yes.
So I am Denise Leonard, reimbursement partner for Plante Moran's Ohio offices. Plante Moran is a full-service CPA and business advisory firm. We have been on Fortune's list of 100 best companies to work for the past 22 years. Healthcare is our second largest industry group, and our team is solely dedicated to serving our clients in the healthcare industry. Please see our link for more information on Plante Moran. So Plante Moran is pleased to support OPRA and its members today in their mission to provide services to the developmentally disabled community. And it's my pleasure to sponsor this session. We want to thank DODD for their willingness to work collaboratively with our industry. Now I'm going to turn it over to Ginnie Whisman and the team with the Ohio Department of Developmental Disabilities.
Good morning, everybody. Welcome to the conference. Glad you could be with us this morning. It's pretty rainy here, so good day to be inside, maybe and be in a conference. So in this session, we're going to cover updates on ICF policy, service delivery topics that we thought may be of interest to you. I'm not going to read the whole slide to you, but topics we think might be of interest to you, and certainly welcome any questions, and Melissa's going to help monitor that for us. So if we can't get to all your questions, we have a slide at the end that will give you our contact information. So I really want to start, first of all, thanking the provider community. If you don't know my background, I've spent my entire career providing residential services to people with developmental disabilities. Most of my career was in private sector, providing both residential day services, and then at the state, we operate developmental centers. So I've never left the provider community, don't want to leave them, because you guys do such fantastic work. And I certainly know how incredibly stressful the pandemic has been. We have heard from many of you about staff shortages, and we really are trying to work with the provider community on those issues, but we certainly acknowledge you're all out there, your management is out there working, and we just can't thank you enough for everything you're doing in Ohio right now to try to keep people healthy and safe. So really, really appreciate everything you're doing. I'm going to quickly go over what the Division of Residential Resources does at DODD, because we kind of have a lot under our umbrella, and I didn't want people to think it is just DCs or ICF. So we do the ICF Program Reimbursement Technical Assistance. That is, we provide technical assistance when individuals are struggling or maybe losing services or their home. Sarah will talk more about exit waiver counseling, and we just added 8 beds. That's due to the DRO lawsuit. We do statewide support teams. So if you've been able to access, we have regional support teams that were put together very quickly as the result of COVID, but we found them to be very effective to help work with county boards and providers in various regions, and they're cross division. So we've got people from many different divisions on those teams, so we can direct any questions or concerns you have to the right team members. As I mentioned, we also do developmental centers. We do medication administration for unlicensed personnel, rental assistance and capital, and housing. I wanted to point out, if you haven't had an opportunity, there's a link on the slide to look at DODD's strategic plan. And as part of that strategic plan, I just wanted to share with you some of the residential resource division initiatives. One is supporting ICFs to offer intense behavioral support to youth age 10 through 17. We're currently in the application period for that. Those are due November 2nd. And again, Sarah will talk more about those. Ashley, if you could just go back one slide. Yeah, just in case you have not read the rule, we put the rule reference there. Thanks, Ashley. We also are going to continue to promote and expand upon technical assistance and support for individuals, their staff, who are at risk of losing services. So if any of you have accessed that, people may call us and say we've got an individual struggling, and we try to send in a team. Right now it's probably virtual, but we send people in to try to see what we can do to support people to stay at home. Obviously, right now there have been unique challenges because of the pandemic, and people really, some people are struggling, some people are doing great because they like to stay at home. So we are helping with that. We're also collaborating with private and non-stop state-operated ICFs. Part of that is they've been so far apart. So a lot of county boards up until the pandemic, you may not have had much interaction with them. And we really want to change that. We believe ICFs are a very integral part of the service delivery system. And we do believe that ICFs need to be more part of the system. So we are working with our stakeholders, county boards, also Department of Medicaid for any issues, and Department of Health. So we are trying to collaborate a lot more with those entities because they all kind of touch the ICF services at some point. We're also, one thing that's really critical is making sure that we're addressing minority health disparities, and people with DD alone can be considered minorities. And so we want to make sure we focus on working on those strategies. And part of how we're doing that is we're pulling MUI data. We're working with ODH to see what data they have on health disparities for people with DD. And we're partnering with NYSONGR. And that's a University Center of Excellence in Columbus, Ohio, if you're not familiar with NYSONGR, part of Ohio State University. Okay, with that, I just want to give you an overview of our divisions. So if you're looking, maybe you don't know who handles what, I thought it might be helpful if you knew what residential resources does handle. And so with that, I will kick it over to Sara Lawson, who will go into more depth, as well as Ashley will go into a little more depth on all those topics. So thank you.
Good morning, everyone. And I just wanted to start off with, kind of reiterating what Ginnie said of, we can't thank you enough for all that you've been doing during this pandemic. The relationships that we've seen form between county boards and our ICFs has been amazing. And we really want to work on continuing that even after the pandemic is over, because I think that we've learned a lot through this of how those relationships can really improve the quality of services that are provided for the individuals that we serve. So one of the areas that is in the division I work in is our community transition team, and we have community resource coordinators. And so our community resource coordinators are working on several different areas right now. And one is technical assistance, which I'll talk a little bit more about here on the next slide. And then we also do follow-along services for individuals that move from ICFs out onto exit waivers in DCs. And the purpose of these follow-along services is just to make sure that that individual is transitioning okay into the community, and that the guardian and the individual are happy with the services that are being provided. And if that individual isn't transitioning well, that we can wrap some services around them to try to, kind of help them be a little bit more successful in their new setting. Also, the community resource coordinators are who are completing the DDPs for your ICFs. And so the initial and 3-year DDPs is part of what the CRCs are doing. And one of the new areas that we're working on is collaboration with the Ohio Department of Medicaid and the Ohio Department of Aging around nursing homes. So we have realized that we have some very young individuals that are living in nursing homes, and we want to make sure that they're appropriately placed and that, you know, they're aware of other services in the community that might be able to serve them. So we're just starting this, and you know, so we might be reaching out to some of you if we find some people that are placed in a skilled nursing facility and don't really meet that level, and still might need some of those intense services that an ICF could provide. So that is something that we are working on. And then quality indicators, the community resource coordinators will be doing the random audits with that. That will be part of when they complete your DDPs. So when you are scheduled for your 3-year DDPs, they would also be doing the random audits starting in 2022. And Ashley would talk a lot more about the quality indicators. We can go to the next slide.
Did you want to check with Melissa real quick and just see if there's any questions on any of those topics?
Okay. Melissa, do we have any questions so far?
No, we don't.
Okay, thank you. Okay, so here's the map regarding who the contact is for our technical assistance, and this is located on DODD's website. I just wanted to make sure you were aware, because sometimes our ICFs, I think, feel as though because they're an ICF that they're not eligible for technical assistance, but that's not true. Anybody can call and request a technical assistance for an individual that is struggling, whether it's in their home, in their work, you know, they feel like they're having some mental health issues that, you know, kind of need a second opinion of, you know, is the team seeing and providing everything that is possible? And we do not look at technical assistance as you're failing. That is not it at all. This is really about just getting a team in there to kind of give a second glance and say, okay, have you tried this? You know, because they've done a lot of these, and on the next slide, we'll talk about how many. You know, they might have some ideas you didn't think about. So, you know, the county that your ICF is in, you can contact that CRC and they will set it up. They will include the county board that is in the area of the ICF, because again, we really feel like we've got to keep that collaboration there between our ICFs and our county boards. And then what will happen is right now we are doing them virtually, but we wrap a team around the TA process, and then you will actually get a set of written recommendations to try to help you problem solve to make that individual more successful. So you can see here, so far this year, we have completed 95 TAs, which has drastically went down because in 2019, we had completed 399. So as you can see though, out of those 95, only 11 of those TAs were done at ICF. So we really want to get that message out there because again, this is a free service. There is no charge for it. And it is really about just trying to help. This is not about judging you. This is not about saying you did anything wrong. This is just about trying to give you some another perspective on some things that might help that individual that you might not have thought of. And as you can see, we also do TAs for youth. So you can call about anybody that you're struggling with that you serve. And again, we will try to do that as quickly as we can. And we do not want people to see TA as looking for an admission at a DC. That is not our mission at all. Our mission is actually to prevent somebody from needing to go to a DC and to make that person successful in their community setting, whether it's an ICF or waiver. And so again, the quicker that you can call us when somebody's struggling, the better, so that we can get out there and try to help you problem solve. Okay, so the last topic I wanted to talk about is, and I know this is one that has been really, really hard for our ICF. You're trying to keep a balance of keeping people safe, you know, yet not restricting their rights. And so we've had a lot of calls from families. We've had a lot of calls from providers about, you know, indoor visitation, family home visits, community outings, school. And so what we've really been telling people to do is to, you know, you can't have a one-size-fits-all policy. You need to be specific to each of your ICFs as you're writing your policy, and you need to look at the risk and benefits. So, you know, we did put on our website a guide that will outline some of those risks and benefits that as a team you should be talking about. So it really should be a team decision when you're talking about, is it appropriate for a child to go back to school? And if you find at the time it isn't because the risk outweighs the benefits, then you need to continue to have those discussions. You shouldn't have a discussion, in August and then wait until February to discuss it again. You should have ongoing.
Sarah, someone would like to know, I'm sorry to interrupt, if you could post the catchment map again?
The link?
Yeah.
Yeah, we cannot, if we send you the link for this and the risk benefit, would you be able to share that with people that attended?
Yes, absolutely. Go ahead and put it in the chat.
Okay.
Thanks. And your own chat. Thank you.
Okay, so really, again, it should be very specific at looking at each individual and what is the risk and benefit and having those discussions. And, I know that there's just been discussions around, people are getting nervous because some counties I know are close to purple, getting into purple. Again, that is part of the risk that you're evaluating. And so you have to look at what that purple is telling you. And pretty much it's saying people should stay home. So you should use that as part of your policy when you're writing it in regards to what happens if you do go to purple. And I hope that doesn't happen, but it does look like we're getting closer to that for some counties. And again, at DODD, what we're telling people is when you're addressing this is you have to look at the risk and the benefits, and you have to talk about that for each specific ICF and look at it for your individuals. And what I will tell you is happening is if we're getting calls from families or guardians saying, we don't feel this is right, this is what this ICF is doing or this provider is doing, we're going to pick up the phone and have a conversation with you. And because we want to be helpful, we want to be able to talk through, some of your concerns. Again, we 100% understand that any restrictions you're putting in place is really about you want to protect people. But, we also have to look at the mental health of our individuals and their rights and determine, the risk and benefit and what outweighs it. So again, I know this has been very, very difficult for providers to find that balance. And, it's going to get even harder as we're starting to see a surge and we're seeing that some counties are, on the verge of turning to purple. And we 100% know that if your county goes to purple, you're going to have those hard discussions with your families because that is a high risk area. And so if you have questions, please feel free to reach out. We're more than willing to help you work through those areas and have discussions. But again, our biggest thing is you can't do blanket policies for your agency saying nobody can visit. It has to be specific to each ICF, and you have to look at the risk and benefits for each person living there. So, thank you.
All right. My name is Ashley McKinney. I'm the ICF Program Administrator with the Department of Developmental Disabilities. I wanted to say thank you to OPRA for having us here today. And just like Ginnie and Sarah were saying, we really want to thank our providers for all of the work that you're doing right now in the midst of this pandemic. We've seen a lot of innovative ideas from providers as you are seeking solutions to the problems that you're facing every day. And we really just applaud the decisions that you're making and the work that you're putting into making sure that you are protecting the individuals that you serve. So I am going to give you some updates about some of the programs and initiatives that are going on in the ICF world and some changes that are coming up soon. So first off, I'm sure you're all familiar with exit waivers and CareStar. CareStar is currently wrapping up the second round of counseling that they were contracted with DODD to complete. And through August of 2020, what they had completed, 83% had selected ICFs, around 4% had selected waivers, and a little over 12% had said that they may be interested in a waiver. So we're just trying to give you a picture of the second time that we're going around and counseling these individuals. The data is overwhelmingly showing that individuals seem to be selecting ICFs at this time. We do want to remind ICFs that even though CareStar is wrapping up this counseling, per statute, you are required to complete annual counseling for all residents on your own. And then down here, I just have a chart that's showing you CareStar has completed 391 sessions from their second contract. Of those, 15 individuals have selected waiver, 327 have selected an ICF, and 49 individuals have stated that they might be interested in a waiver. Just in case you're not sure what it means when someone says they might be interested in a waiver, when that happens, we get the individual in contact with the county board so that they can give them some more information about the specific providers and housing opportunities in that county so that the individual can decide if that living arrangement would be good for them and if they would really be interested in actually moving in before they take that waiver allocation. All right, now we're looking at total allocations and enrollment since the beginning of this program, since the beginning of the exit waiver program. So here we have it by quarter, the total waivers allocated and total waivers enrolled. We are reporting this quarterly for DRO, for the lawsuit, and so we're just sharing that information with you here. To clarify, the waivers allocated at the end of each quarter is a snapshot of how many were allocated at that time. So individuals do have the opportunity to change their mind about their allocation. If an individual was originally allocated a waiver and they look at their options and decide that the ICF is really the best placement for them, then they can certainly contact us and retract that waiver allocation. And while there are individuals contacting us to retract waiver allocations, there are also new individuals contacting us to make new requests for waivers. So these numbers are very fluid, going up and down throughout the quarters. And so we are giving you a snapshot of the final day of the quarter, how many waivers were allocated and how many were enrolled. So we're showing
Ashley?
here, yeah.
Pardon me. If you don't do a blanket policy for a facility and let family visit an individual, aren't you introducing the possibility of COVID to everyone in the facility?
Sarah, would you like to jump on and answer that?
Yeah, so again, we're never going to be able to completely have no risk. What we're saying is, and I put in the chat, the risk benefit guide, is there are individuals that are at higher risk. So if you have, let's say, a 6-bed facility and they're all 20-year-old men, that risk is going to be probably lower when you look at what their needs are based upon, you know, a 32-bed facility that serves individuals on vents. So we acknowledge we know that there's no way that you're ever going to not have people at risk. You have staff coming in and out every day too. And we know you are doing your best to absolutely keep COVID out. And so what we're saying is you can't just say nobody can visit. You have to look at the specifics for that facility and have team conversations. Because, you know, it really is about having a conversation. And I think when we've seen facilities be successful, it's really been about that communication that they're having with their families and talking through some of that. I think where we're seeing where facilities are not successful is where they're just telling families, nope, nobody can visit. That's our policy. We're not allowing it. And that's really hard for families because, you know, they miss them. I mean, this is affecting everybody, whether you have a developmental disability or you don't. It's affecting the mental health of a lot of people. And so, you know, you have to have those discussions around knowing that there is going to be some risk when you're doing visits, but you have to do your best to, you know, use the PPE, the hand sanitizer, individuals take showers after, you know, and all we're asking is that you really try your best. And there is going to be situations where a visit might not be appropriate, but communication and team process is very, very important for that. Thank you.
Okay, So just to jump back in here, we're just showing you then that over the last quarter, we had an increase of 45 new waivers allocated and an increase of 45 waivers enrolled. And something that we have seen some individuals and providers utilizing for the COVID-19 situation is some individuals are choosing to take longer visits home to be able to kind of mitigate the situation where they didn't want to have shorter visits at the facility. They're taking longer visits home, and the ICFs can utilize bed hold days in those situations. We do have guidance that we published where ICFs can request 30 days at a time for bed holds if the individual would like to go home. And so we have some ICFs that are getting creative about helping the families provide services at home, whether that be virtually or maybe having a staff member stop in at the home and provide some assistance if needed. But they're helping to coordinate that care that way so the individual can be at home and have less risk of exposure to others. We also have some individuals that have decided to utilize an exit waiver for this time so that they can get waiver assistance while they're home. And then I think once the pandemic is over, their plan is probably then at that point to return to the ICF. Going into a little bit more information, Ginny had talked about how we're starting now the exit waiver counseling through CareStar at our 8-bed facilities. So CareStar has been contracted to complete counseling now through our 8-bed facilities, and they are just now starting that process. So we went through and pulled all of our individuals that are residing in 8-bed ICFs. If they did not have APSI as a guardian, if they did not already have a waiver allocated, and if they had already if they'd already requested not to be placed on our do not contact list, those individuals were pulled out of that list. And then we are sending letters and emails to the individuals and guardians to notify them that CareStar will be reaching out. It kind of tells them who they are, what they'll be doing. It also gives them the opportunity to contact me directly and either go ahead and request a waiver if they don't want to wait for counseling, or they can also contact me and ask to not be contacted by CareStar. So they can be added to our do not contact list without having to wait for CareStar to reach out to them if they know that they're not interested in a waiver. And then CareStar is also working diligently to come up with options to get creative again with COVID, like everybody else is. So they are offering video conferences via Teams. Sometimes that's with the families present. And then other times they're also making sure that the materials are available to the queue ahead of time so that they can have those physically present for the individual to be able to look at and hold during that meeting, so that it's a little bit more, tangible for them to see that material. Okay. We've recently finished setting our rates for fiscal year 21. So this is just kind of an overview of our changes from fiscal 20 to fiscal 21. So we had an increase of the statewide average of 2.34%. And we like to look at that sometimes with the franchise permit fee and without the franchise permit fee, because we did have an increase. It was a smaller this year than it was last year, but there was an increase in the franchise permit fee. So if we don't account for that, we still had a 2.22% increase just in the actual rate portion if we weren't including the franchise permit fee. And then you can just take a quick look here at the other sections of the rate components and see where the rates are increasing. We do have a slight decrease here in the protected rate. And I believe what happened there is we have a part of our formula where we adjust for the inflation factors. So our inflation factor forecast for the year previous must have been a little high, and so we had to adjust that down a little bit this year to account for that. But our statewide average this year is $350.87. We also have on our website, if you go to the ICF section and then go to the ICF billing area, there is a complete list of all providers' fiscal year 21 rates that have been set. And then we're going to look forward to what's reimbursement going to look like in fiscal year 22. So one big change that we have coming up is the quality incentive. This rule was initially planned to be in place a lot earlier than it is going to be now. So with the COVID changes, we obviously had a few roadblocks, a little bit of a delay, and now the targeted rule date is going to be December 2020. And since our rule date has changed, we're also adjusting our implementation timeline. Since we didn't have that rule in place where we originally planned to, we also want to make sure that we adjust when we expect providers to have their policies in place. So written policies were originally going to have to be in place by December 31st, 2020, and we're now changing that to March 31st, 2020. That should say 2021, I apologize, 2021. So we're giving you a little bit more time, an additional 3 months, and we had to cut it off at that 3/31 because that is when cost reports are due, and the quality incentive information is submitted with your cost report information. We did have a couple questions come in. Do the policies still have to be in place and just not submitted until 3/31? And to clarify on that, it doesn't have to be implemented, in place, or written until 3/31. And then that is also when you have to have it submitted to us by. So if you do an extension on your cost report, a lot of providers do that 14-day extension and submit in April sometimes. Your policy would still need to have been in place by 3/31 of 2021. You would just submit it then in April with your extension that you've been granted on your cost report. Then with that quality change, you're going to see that the direct support personnel payment, which was previously 3.04%, is going to become 2.04%, and 1% of that initiative is going to transfer to the quality initiative, effective with the 7/1/2021 rate. As Sarah talked about previously, we are going to start random on-site reviews beginning in January of 2022. That is what is originally outlined in rule, but because it was so far out, we feel that providers have plenty of time to get their policies in place, get them implemented, and be prepared for the community resource coordinators to come out and review those policies. Melissa, before I go on to the next topic, are there any questions on any of those?
Yes, they would like to know when they can receive the slides.
Do you want, I can, if they would like to email CR-ICF, and I can put this in the chat for you if you'd like me to, at dodd.ohio.gov, then we can send those slides on today for them.
Or Melissa, if we share them with you, can you send them to the participants so they don't have to request them?
Yes, I'd be happy to.
Okay. Ashley can go ahead and send them to you. I think that would make it easier so that people don't have to request.
Yeah.
Okay,
Yeah, no
thank
problem.
you.
Sure. Thank you, Melissa. Okay. So another big topic that providers are asking about and trying to plan for is what are the changes going to be around reimbursement in fiscal 22 related to COVID-19? There have been a lot of incentives related to COVID-19 for ICFs, and there have also been a lot of just changes in maybe some of the expenses that you're used to having. So we're going to recap a little bit of that and the guidance that we're putting out, working with Medicaid, trying to help clarify some of this for providers. So there is a Medicaid advisory letter 647 that covers some of the reporting for COVID-19 pandemic related expenses and funding. So I'd encourage you to go out and find a copy of that. It will be helpful for you. In that advisory letter, it does clarify that PPE can be reported in the medical supplies account under the other protected cost center. I also further clarified after getting some questions from providers that sanitizer, whether that be hand sanitizer or cleaning supply sanitizer, if it is being used for the purpose of mitigating COVID-19 concerns, it can be placed under the PPE account. If it is being used for the purpose of normal housekeeping and cleaning as it would have been prior to the pandemic, then you should continue to report it as you would have before. But again, if that sanitizing product is being used to prevent spread of infection for COVID-19 and it's above and beyond what you would have been doing before, then you are able to report that and the medical supplies. We've also clarified with Medicaid that some providers got creative with some of their PPE, especially at the beginning of the pandemic when you could not find masks or you could not find face shields. And so if providers purchased bandanas or raincoats or whatever it may be that they were utilizing to help provide protection for their staff or individuals before they could get actual face masks or whatever it is that they're using now, then those are also going to be allowable to be reported in the medical supplies account. And then we have some of the incentives here that we're recapping. And we have worked with Medicaid to confirm that the incentives should all be reported as other revenue on the cost report, and you will not be expected to offset those costs. So you will be reporting the revenue, and under other revenue, there are individual lines where you can outline which incentive it was and how much you received for that specific incentive. But then we do not expect you to go back and then offset the cost in the actual expense areas. We do want you to maintain documentation to support the increased cost or a reduction in revenue. And you're going to want to look at the specific incentives that you are utilizing and what their criteria were. So I've heard that with the Paycheck Protection Program, maybe some of the requirements on that are different than with the CARES funds, the CARES Act funds. So on the Paycheck Protection Program, if the requirement is that you've maintained a certain level of staffing, then we're not going to expect to see that you have costs to account for those funds coming in. We would expect to see that you have those staffing levels that were accounted for. And then with the other incentives, like the CARES Act funds, we are going to want to see where you can show the increased costs or reduction in revenue. So on here we have the BWC COVID-19 employer dividend. There's a specific Medicaid advisory letter on that topic at 646. DeWine did just recently announce that they're going to be doing a second round of that. And so that advisory letter will apply to this new dividend as well. It will be reported as other revenue and will not have to offset costs. With the coronavirus relief fund through the CARES Act, those funds, we have some additional clarification on. We do want to clarify that the deadline for applying for that is tomorrow. And so if you've had any difficulty getting that to process, or if you have not applied yet, I encourage you to reach out to us after this presentation so that we can help you make sure that you get that through and don't miss out on those funds. We've also had a lot of questions around, excuse me for just 1 second. Sorry about that. We've also had a lot of questions around how this can be utilized for payroll. And so there was a notice that it could not be used for bonuses or for raises across the board. And so we have clarified that the intention of the terminology across the board is that they don't want to see a raise granted for office staff and administrators and presidents and CEOs. They don't want to see the entire staff of the entire agency getting a raise across the board. But if you were to grant a hazard pay raise to your direct care staff that are actually working in the ICF, so they are exposing themselves to the risk of being out and working in the field, then it would be appropriate for you to grant a hazard pay increase and say that this increase will be in place during the state of emergency. So if you have any other questions around that or specific instances where you just want to kind of check in and make sure that you think that that falls in line with how things can be used, then feel free to reach out to me and I'll help you make sure that we get that clarified. So there are just a couple other incentives on here, and I'm sure that there might be additional incentives come up or some that we haven't touched on. If you have any of those, please feel free to reach out to me. I'll make sure that I can get some clarification for you, and we will try to get those added into written guidance I know that the providers have expressed that that is how you would prefer the guidance to come out. So that way down the line, if it's needed, you have something hard copy to go back and reference. So we will attempt to get that for you. We do have some upcoming system changes working with Medicaid on the new provider network module. They did announce on October 31st that the Ohio Department of Medicaid is rolling out a single entry provider network module called PNM, and it's scheduled to go live in March of 2021. DODD Provider Services Management, PSM, has deadlines that they have announced for system transition. So here you can see when the applications are due for ICF CHOPS, ICF closures, new ICFs, and then it also has a date here, 2/16/2020, that should also say 2021, I apologize, for all in progress or draft applications to be completed, or they will be deleted as of that date, and then you will have to submit a new application in the new PNM system after it goes live in March of 2021. There will be a lot more information and training guidance coming out around the system, but this is the limited information that we have now that we are able to share. There is also going to be an update to the cost report submission process, and so I wanted to make sure that I outline that. Cost reports will no longer be submitted through MITS. They will be submitted through the PNM system beginning in March of 2021. So if you would like to submit your 2020 year-end cost report via the MITS process that you are familiar with, then you will need to fully submit that cost report prior to March of 2021. After March 1st, any partially submitted cost reports will be removed, and you will have to submit a complete new cost report package in the new PNM system once that launches. Like I said, there will be a lot more details and training to come, and if you have any specific questions regarding PNM, they do have a dedicated email address here that I will give you a moment to write down. That is pnmcommunications@medicaid.ohio.gov. And that email inbox is monitored to answer questions specific to those upcoming changes. And if there are questions specific to ICF that maybe they can't answer on that side, then they will delegate those out to our area so that we can help answer those for you. So before I pass it on to Than, I'll just check in with Melissa one more time. Are there any other questions related to the ICF topics that I've covered?
No, and we are at the 9:45 mark. I think you can go ahead and with the last part of your presentation.
Okay, thank you, Ashley, Sarah, and Ginnie. And really, I do want to extend that thank you even more in capital letters, and the idea that I truly think Ohio has set the example across the United States in communication, collaboration, cooperation with the State Department and the private providers in the ICF realm. Participating on monthly calls, there's more complaining than there is thanking various state departments in other states, and really Ohio to me has absolutely set the example of the fact we're all in this together, and together we work together. And I just tell you, Ginnie, as you know, we here at OPRA, we tremendously appreciate all you have done and your staff to assist the private provider for ICF services. I wanted to report out to also those on the call that we do a monthly call, and I'm fortunate that through Anchor that I participate on with CMS ICF division. And at times our discussions here within the state have percolated up to being part of that agenda at the CMS level. So I'm very very helpful. I really appreciate the fact that both DODD and the private providers through OPRA have a forum that we can get straight to CMS. And my 20-some years in the ICF program, actually 37 years in the ICF program, we've never had that direct call on a monthly basis. The other then is to switch back to stark reality. We are still in the pandemic. The expectations are that we will be coming out of the pandemic soon. I don't know what that means as far as soon, but we have to go back to the fact that the ICF program is going to be starting surveys. Right now, they're based on incidents, but there will be renewal surveys coming up in the near future. We've been told at the federal level, they're not changing any part of those protocols. So let's go back to things that we should worry about, which means look at your emergency preparedness plans, make sure that they include things that you have done as a result of the pandemic, such as how you do food service or meals, such as active treatment, where you're doing most of those active treatments in facility as opposed to out, things of that nature. Third, then, when we look at visitation policies, obviously we have gone from no visitation to outdoor visitation. Those were covered with a governor's update on doing outdoor visitations and things that we needed as providers to do to make sure those were safely completed. And then with indoor, which we're going through right now, obviously there have been some challenges to that. All of those discussions that we've had here in Ohio have also gone up to CMS as they look at state by state by state on how things are occurring within the ICF program. And again, to our knowledge, the visitation policies that you all have been reasonably accepted with minimal amount of challenges. Ohio was one of the few states that has had OSHA come in and look at a follow-up to an employee COVID-related incident. So be on the alert that OSHA is still around looking at those things more so on the employee side rather than just the consumer side. We talked about the future surveys, again, going back to active treatment plans, emergency preparedness, document. You've heard me say throughout our calls on the state ICF calls, document. Federal oversight, there doesn't appear to be any changes in what they're training their surveyors. We've asked every month, are you going to be doing an update that will include private providers on any changes in how you train your ICF surveyors in the various states? And at this time, there is no changes. So it's it appears it's just going to go back to where it was prior to the pandemic. The one question I wanted, and maybe Ashley, you would want to potentially participate in this answer. But when we look at the CARES Act funding, we all have to remember this is one-time funding. Does not necessarily mean that it's going to be within the reimbursement dollars for the ICF program into the next biennium. And so we have to make sure that providers understand that those CARES Act funds are really occurring just this year at this particular time. At this time, Ginnie, that's the end of my presentation. Again, I appreciate the three of you spending your time with us this morning, but let's go ahead to see if there's more comments or questions.
Sure. If you want me to touch real quick on that topic that you just talked about, Than, I have been discussing with a couple providers that if you have the expense accounts that you can utilize those CARES Act funds in, because we have worked to make sure that the funds are just reported in revenue and not offset in the costs. If you're not just utilizing the funds for lost revenue, which wouldn't be reported on your cost report, if you're utilizing the funds for actual expenses to cover expenses, then those will be included on your cost report and will be calculated and factored into your rate going forward. So if you have the choice between counting those CARES Act funds towards your hazard pay or whatever it may be that you're doing, versus just counting them towards the fact that you've lost revenue because you have some empty beds, if there's a way that you are able to utilize them so that they're on your cost report, they will count towards your rate setting for next year.
We do have one question. She says, this is random, but how many ICFs remain in Ohio?
We have about 420 ICFs right now.
Actually, do we have numbers, those that are in the private sector, those that are in the developmental centers at this particular time?
420 is the private number.
Yeah,
Or
no, I
do you
mean,
mean
individuals
I
licensed.
think we have around 4,500 individuals right now in ICS. I don't know if Ginnie has an idea. I know I have an email, but I'm afraid if I try to pull it.
I just looked, our last number was about 4,800.
Do you have the number for the DC side? It would be in that email that Lisa just recently sent.
Yeah, the developmental centers have about 611 people right now. And as most people know, that ebbs and flows. So that's at any given time, we have about 611 because we only do short term. So people are in and out. We serve more than that in a year, but at any given time, it runs around 611.
And Ginny, that your reference to that it basically is short term, is the developmental centers have dramatically changed their role in assisting individuals to stay in the community if at all possible, being short-term visits and then medical write-ups and behavior evaluations, which I think is a dramatically positive change for Ohio's developmental centers.
Thank you. Are there any other questions? We have about 8 minutes, I think.
No, you got a shout out though. Shelley says, great presentation team, much important and timely info. Thank you.
Well, thank you, Shelley.
Well, if there are any other questions, please put them in the chat.
And our contact information is there. Please don't hesitate to reach out to us because we really do want to help support you.
Yes. Okay, well, thank you very much. This was a wonderful presentation. You had about 63 attendees, and I will send the presentation PowerPoint to all of you. I do have all of your contact information when you registered for the conference. So I have all of your emails, and I have launched a poll to close out the CEUs. Please fill out that evaluation, and that will close out your CEUs, and Sonia Summers will be in touch with you about that. So thank you all, and we will see you at the next session, which is
Be
at
safe.
10:15.
Yeah.
Yes.
Yep. Be
Thank
safe.
you.
Yes. Thanks all.
Goodbye.
Bye.